phone on mute unless you're talking. That way we reduce any background chatter or anything like that that's going on so everybody can be heard thoroughly. So we're going to go ahead and conduct a quick roll call. We'll start with our hospitals, starting off with Anderson.
This is Eric Brandmeier. I'm here.
Morning, Eric. Thanks. Alton Memorial.
Hey, Phil. It's Ashley Spear.
Hey, Ashley. Good morning. Carlinville Area Hospital. Or how about I not skip Boyd? Boyd.
Nancy Wollmeyer here.
Hey, Nancy. All right. Carlinville. Staunton.
This is Sue from Staunton. I'm here.
Morning, Sue. Fayette.
This is Tina Evans, and I'm here, and I'm glad you're doing a roll call.
Good morning. HSHS. Oh, I'm sorry. Gateway.
Danielle
Rick.
is here.
Got
I
you
believe
both.
Danielle's on as well.
Yep, got you both. Thanks, Rick and Danielle. We'll run through our HSHS group. Anyone from Holy Family? St. E's.
Brad Perry's on.
Got you, Brad. St. Joseph, Breeze, Highland. Okay. Jersey.
Kelly's here.
Good morning, Kelly. You got myself, Lee, and Scott Klosterman here from Belleville. For East, we are covering for East as well. Chester.
I'm here, Phil, Georgia.
Gotcha, Georgia. OSF St. Anthony's. Redbud. Sparta.
Dan's here, Phil.
Gotcha, Dan. Thank you. Touche. We'll move over to our health departments. Bond County.
Terry, I'm here.
Gotcha, Terry. Calhoun. Clinton. Eastside Health District. Fayette. Greene County. Jersey. Macoupin.
McCoupin's here, Phil.
Gotcha. Madison.
Hey, Phil. It's Michelle.
Hey, Michelle. Gotcha. Monroe. Randolph. And St. Clair. We are having a fire sale on local health departments today, apparently. And I am
Randolph
missing.
County.
Oh, I'm sorry. Who was that? Randolph County?
Life is a dream, realize it.
I'm sorry.
Life is a challenge, meet it. Life is a duty, complete it. Life is a game, play it. Life is a promise, fulfill it. Life is sorrow, overcome it. Life is a song.
Someone has their phone unmuted. I'm sorry. 7192. If your phone ends with 7192, please mute your line or I'll mute it, unfortunately. All right, we'll move over to our community partners. Greg, are you on for our REMS?
I'm on.
Gotcha.
Yes, I'm on.
Thank you. Beth Busman?
Yes, I'm here.
Gotcha, Beth. Thank you. Any of our BJC partners? Any of our local emergency management agencies? To include, we'll include our fire folks. All right. MedStar ambulance.
Chuck's on.
Thanks, Chuck. SLU.
Hi, Helen Samples here.
Gotcha, Helen. Thank you.
Thank you.
Scott Air Force Base, and any of our stars folks. I know Dale was out. Okay. And anyone I have not called. Eric, I see you're on. Ruiz, I see you.
It's
Yes,
Stephanie
sir.
Wibble from Clinton County Health Department.
Gotcha, Stephanie, Clinton County. Thank you. And I got you too, Eric. Thank you. Anyone else? Last chance. Once, twice, thrice. All right, we'll try to keep this meeting moving kind of quickly. Welcome to our September 2nd, 2020 quarterly meeting. This is one of our 4 traditional quarterly meetings where we kind of definitely go through our primary agenda. Our last monthly meeting, we went through our primary agenda as well because we had a few specific announcements from folks. But today we will repeat that, wash, rinse, repeat, and move on. So we'll do a COVID update today. Then we'll go through our traditional lineup. We'll go over a few updates with regard to the grant and our pediatric annex. And then we're going to have some time here today to do our D4H kind of training / demonstration. So a lot of you guys have received D4H accounts, our common operating picture. If you haven't, please email myself and Lee. We'll get you squared away. But that's going to be the new home for a lot of us in doing our day-to-day coalition activities and for disaster response. So we'll give Lee an opportunity to kind of go through the motions with D4H, show you how to use it. And this will be out for, we'll sit up there for training as well. But it will also give you an opportunity to ask questions and see how we can move forward with it across the region. So we'll start off with just our region COVID data. I didn't include today's data. This is from yesterday's because we had a few folks not updated before 10. So this is what we're looking at. What we're looking like is you can kind of see, you know, we had our highs in April and we kind of went through this bathtub area right around my birthday, June 28th-ish time frame. And you see this bathtub, and now we're back on a steady rise with regard to hospitalizations. I didn't include the memorial. We had like a memorial one that we were tracking just internally to see, you know, what load or what capacity our census was to the entire region. And it had been quite high for some time, but once we got around late July, we started to get that peanut butter spread, and more folks were picking up more patients across the region. As of right now, the good folks over at St. E's are doing a yeoman's effort. Their census has been higher than ours for the past 10 days. So I know they're feeling the brunt of that. And the acuity of patients have been a little bit higher as of late. So when you see that maroonish, reddish line that's above, that's the impact line. What I call the COVID impact line, and below that is just the general census for PUIs and COVID positives. This basically means that we've either had a lot of deaths recently, or we've had a lot more folks in ICU on ventilators. So over the last 3 days, anytime you see a big gap between the blue line and the red line, that's what that's showing you. Okay. Also, our folks up in Madison County, up at Alton, have been having a fairly high census with COVID patients as it relates to their traditional mix of patients, and the folks at Anderson. So we have seen that growth in Madison County and otherwise. Any questions just about this slide? Because I know I send it out and some folks sometimes are like, oh, I don't know what this means. Any questions about it? Okay. As you guys are fairly aware, as a part of the resurgence mitigations for Region 4, the governor and IDPH said that they were going to monitor our percentages for the next 2 weeks up till September 1st and make that determination of whether they were going to impose any more restrictions, with the goal of getting us back to below 6.5%. And as you can see, both us and the good folks a little further up north in Region 7. So Region 4 and Region 7 are still trending above that 8% line. And as of that number, it says 28th, but the 29th, we were still trending at 9.6%. And you can see those where we had consecutive days of increases until we got to the 29th, where there was a slight dip. We went from 9.7 or 8% to 9.6%, where we're at today. I had some misgivings, I'll say, about the data just internally in my brain, but I went and ran the data just straight off the site, and all those numbers were accurate based off of the site. I do know that there is some conversation going on right now across Region 4, just trying to relook at those numbers to make sure that everything is being captured properly, to make sure that that number is as accurate as possible. And I don't want to put Greg and Beth on the spot right now, but I will just ask, has there been any other conversations that you guys have heard through IDPH on about the numbers, and could we be potentially missing some data? And if not, or will we still be using the exact same method of collecting that data from health departments and other entities?
I have not heard about any changes. I know that they put you in contact with the data people. Did you talk with them, or?
I just shot an email and asked a question, so I haven't got nothing back yet, but we'll see.
Yeah, I have not heard anything. I think our high was 10.5 a few days ago, so we trended down again now that it's 9.6 today. But we remain with, I think it's 8 of our counties, 9 of our county health departments, if you want to count it that way, are in orange right now. So I'm not shocked by the 9.6%, but like you, previous to you, I did take the data that was being shared and ran the numbers, and they were correct according to the data that that they were putting on the website. I mean, the numbers and, pulling out my high school algebra or whatever and dividing, and I was coming up with the same numbers. Now, as for whether the actual number of tests versus the number of positives and all that is correct, I don't know about that aspect, but I have not heard anything different. Beth, have you heard anything?
No, I think you summarized it. There are a lot of really smart people in Springfield and Chicago, and some private consultants that are constantly looking at these numbers and trying to make the data as accurate as possible. So yeah, that's about all I can say. And they are aware that a lot of people are looking at these numbers very closely. So I feel like those data scientists and epidemiologists probably know more than, as Greg said, my high school algebra. The data that goes into the program is what we need to try to make sure is as accurate as possible. When you're dealing with such large numbers, sometimes that's difficult. But yeah, there are a lot of people looking at this. And the other thing to think about is these numbers are fairly consistent with what we're seeing on the other side of the river, which kind of, as a general check, to me shows that these are probably somewhat accurate. If there was a big difference from what we were seeing in the health departments over on the other side of the river, then I would say, yeah, maybe there's a problem here, but they have been pretty consistent.
Got it. And it would be consistent also with, obviously, the, when I back up this slide to look at the hospitalization rate, again, we hit that all-time low at the end of June, and now we've steadily increased since. So I think it all parlays, fairly well. I'm just hoping we don't hit our all-time highs again, because I know that folks in the hospital said, I know we struggle with staffing and some of the decisions that we have to make. So if I see it day to day, I know you guys are seeing it day to day, and it's just something you gotta kind of muscle through. So hopefully we get those numbers get pushed down. So in that in the resurgence, I don't know if we say luckily or not, but we did not have any hospital specific additional restrictions put on us. So I think folks are still managing to do what they do day in and day out. I honestly thought maybe visitation would change, but that did not. Now, if we continue over the next 14 days and they reevaluate and that number either continues to go up, we may see some changes. But hopefully we can push, with the additional restrictions, maybe that'll push things down. I did venture out last night to catch a movie with my kids yesterday. We went to see Tenet. It was a good movie. But one I really was curious is to see, because I had outside of Walmart, I hadn't been anywhere. I was very curious to see how a lot of these restrictions had been implemented. And I'd say the good folks at the theater that I was at were doing a great job cleaning. Everyone was constantly cleaning things. They had great social distancing and the like. So, and it was only, I'd probably say 6 people in the actual movie theater or the theater that I was in. So, so folks look like they're doing a good job in some of our establishments. So hopefully these numbers will trend back down and we can get a little bit more relief and hopefully a little closer to vaccines. So, Greg, I'm going to turn it over to you for your update from IDPH.
Yeah, so I was just looking at your mitigation. That looks like, so new mitigation went in today. And I'm not sure if that's them or not. It looks like it's them, but I don't see the part about they can't open until 6 a.m. after they close at 11. But is that on there? Because that was one of the things.
Greg.
Yeah, so I'm not sure you have the latest there.
Yeah, this was the one that went out yesterday. So I probably could have pulled the snapshot, because I think you're right. The website does have 1 or 2 things that might be slightly different on here.
Yeah, I think they did that can't reopen till 6 a.m. because I think some were closing at 11 and opening at 12:01 a.m. again. But for IDPH report, the only couple of things I just have, because some of you guys do deal with the trauma. I know I sent those letters out. The trauma funds were distributed a couple of weeks ago. And I did just want to once again reiterate that ours was considerably lower. The fines, the moving vehicle fines were much decreased for our region. That's why the funds are lower. There's been no reason given other than I can think with COVID, we weren't driving as much. Maybe the police were distracted with some of the civil unrest and some of the COVID response and weren't, doing much. So if you want those funds to go up, please get on the highway and speed so that you can get a ticket and we can have more trauma funds. But that is why they are decreased. And then the only other thing that really with the coalition is they have their fingers crossed and they're really hoping that the grants will be executed by the end of the month. So let's keep our fingers crossed and hope that actually happens. And that's pretty much all I have.
Awesome, thanks, Greg. And yeah, let's hope that happens. I'll give a little bit of that on the grant update, but that would be great. And wear your seatbelt if you are speeding, or even when you're not speeding. Make sure you wear your seatbelt.
I was joking.
We know, Thanks, Greg. I know we didn't have anybody on from Stars specifically, but did anyone join a little late by chance from Stars? Yeah, I know Dale was out, so okay. Remer, Mike. Is Mike silenced? If you're talking, you're muted, Mike. If not, we'll just skip over to Lee or potentially Leanne if she's on. Lee?
All right, so yeah, we actually had a officers meeting last night to discuss the REMERT programs and what we have going and what we're looking at. Because we are the same as everyone else, we're down to doing virtual trainings. We're not really doing anything in person right now because of COVID. So not a whole lot going on since the ostrich. There's not been much else. We will still, of course, if a call goes out and, they need support, we'll go out on a real call, but in-person training is kind of just in limbo right now. Other than that, not much to say.
Got it. Thanks, Lee. And we'll move over to Sue. Any updates on the mental health side? I didn't hear Dana on, so.
Hi, this is Sue. Yeah, I spoke with Dana. I emailed back and forth with Dana and asked him, told him we missed him and asked him if he still maintains the consortium as a resource for our coalition partners. I also asked him if he had a current list so we could update our contact information in our call out system. And I also felt like we needed to do a call out drill. Told him that we missed his annual mental health symposiums and asked if he planned on doing anything virtual in that respect, and told him that I could help him with anything he needed. He just responded back today. He said, things have been going reasonably well considering everything. We still do have the disaster mental health team, and we're active in April through May with a dedicated phone number for first responders and medical personnel who are experiencing stress and anxiety related to COVID and in need of brief intervention. We ended up only getting a few calls, even though we expanded to include long-term care facilities. I need to regroup and decide how to proceed, I guess, with that program. I don't know if that's still in play or not. He said, essentially, I did a call out early April in response to interest for the above disaster mental health for first responders, was able to get good response via email contacts. Let me think more about future call outs. We are doing a lot of suicide prevention training via Zoom, and I'll send you out the next notice. So I will share that with you for our coalition when I receive it for the suicide prevention virtual training. But it sounds like he's thinking about stepping back from actually keeping a database for actual call outs in our system and moving back to email response, email communications with his group. He has not, given me a final yay or nay on that, but that's kind of what I was reading into it. But he sounds like he's got still the group and they're active. So that is still a resource for our coalition. That's all I have.
Great, thank you, Sue. And I'm pulling up just the flyer, one of the flyers that Sue was just discussing. So this is still up and operational. So that line that's there, 618-381-5173, will get you assistance or someone that that needs assistance. And it is a free resource. So please take advantage of it if needed. So thanks, Sue. All right, let's pull that back up and on to the next slide. So grant status. All right, so you've seen part of this slide before. Last time we talked, we made all of our deadlines, got all our information in back on, I put 9/27, I should say 8/27, I apologize. But we received some feedback. We only had 2 small areas that required some adjustments. We did those the same day, sent them back a day later. So IDPH has all of our grant related info. And as Greg was saying, if we can get to an executed grant, sooner rather than later, and if by the end of the month is a true possibility, that would be the fastest since I've been here, and since probably everybody's been here. But I do know that they're working very diligently on reviewing those grants and getting them, back out. We've made, I'd say, substantial headway, even though this was later in the year than traditional. I do think some of the walls that COVID has broken down is some of the, I don't want to use red tape or bureaucracy, however you want to call it, but that has, been, shifted a little bit because people understand that time is of the essence. One of the things that I would say about the folks up there at IDPH is that they are trying as hard as possible. Some of you also may know, and Greg, I know you made an announcement on this. I think maybe it was last week, but we did have a change up at IDPH. So for those of you who are not aware, Win Rawls, who's the deputy of for preparedness and response, his role, he is no longer with IDPH, and now Andrew Friend is, and Andrew is a friend of the coalition. He actually has a coalition coin, as a matter of fact. Who's going to be coming over from the Kingdom of Saudi Arabia to fill into his new position. He worked at the state level there, both at the hospital level and the state level there. He has a paramedic background, all around good guy. We've known him, I think I've known him for the past 4 years, and have stayed in pretty much constant contact over the years. So he will, I think he'll be great for IDPH and for what we do. Especially in a hospital setting. I know there would be some things that he maybe not used to as of yet, but he'll get there. So be on the lookout for him, and I'm going to try to get him to introduce himself fully at one of our upcoming coalition meetings. So please stay tuned for that. Our work plan. So with that grant, inside of our work plan, these are all the major kind of milestones that we need to meet. And I have them in basically what month of the year that we're trying to knock those out. So the surge estimator tool, you guys did that, I think very late last year, early this year. We're going to try to knock that out a little earlier. And what's good is because the simple fact that we did it maybe December of last year, January this year, you probably can resubmit exactly what you had. So I'm putting together an email to go out for you guys, but for all the hospitals to complete that tool, I will consolidate the information and that'll be uploaded into the coalition assessment tool, the CAT tool, which you see is the next requirement. Whenever that opens up, I have not checked it as of yet, but last year it didn't open up until very late. But I'll work in there and adjust it, and I normally will send that out to the executive committee for review and any questions or feedback. But I try to answer it for the coalition. There's only one account holder, and it's not like SIMP or anything else where multiple people can have access to it at the same time. So I try to fill it out, get feedback, and I take the feedback that I'm filling in are basically things that we're working on across the region, and also the information that you guys provide through some of these tools, the surge estimator tool, the coalition surge test, etc., to fill those out. So I'll be knocking that out hopefully earlier than later. So I'm looking at that being done in October. We need to conduct a pediatric facility recognition program briefing. I'm going to be targeting November for that. We'll record that and get that on the YouTube page as well. But we normally do that every other year. And Anna did it the last time, and we'll probably have Anna do that again. So that's talking EDAP and the like. Medical countermeasures briefing, we normally do that annually. We're going to try to move that up. Instead of doing it in February, we're going to try to do that in November. So I'll try to get Carla Little from IDPH, who manages the program to brief. If not, Beth, hopefully she'll fill in, and Greg, as usual, will probably be going over the same stuff, but good information nonetheless. The Coalition Surge Test, looking to do that in December, and this year we're going to do it slightly differently. We're not going to do the full evacuation version of it. We're going to do more so the MCI version of that Coalition Surge Test, or maybe a hybrid of both. But we're going to try to give you guys an opportunity to go through and triage and talk through and walk through what you would do to actually take on a ton of, I don't want to say a ton, but a surge of patients from a mass casualty incident. So if you want to sign up for that now, just send me and Lee an email and Scott an email. We'll make sure that you get taken care of. We'd like somebody to host it. We did the first one, and the good folks at OSF St. Anthony's did the second one. Tina out of Fayette, they hosted me out there and a bunch of our folks. So during this last one. So we're looking to try to expand that and give a little more bang for the buck this time, and while conducting social distancing if at all required. Training and exercise planning workshop and update the MyTAP. Try and do that in December. That MyTAP is in SIMP, so you can see that today. Update the coalition governance documents. Just taking a look at I use bylaws loosely, but taking a look at that and updating that. We normally do that in January, but we'll try to do that in December because we want to update those regional plans by January, and that's the next one. So I'm going to be putting out, I'll start that probably in November or October timeframe. We'll leave it open for suggestions, recommendations, and the like, and then try to approve those in January. HVAs. Need to be done. We'll try to get that done by February. But that's always pending when they're available in SIMP. And I have not taken a look at that yet, but nonetheless, we're going to try to get them done by February. ChemPAC communications drill. We're looking at doing that in February. That's basically running the gamut of what we do have outlined in the ChemPAC plan, which is directly aligned with what's in IDPH's ChemPAC plan. So we want to knock that out. Very simple. We'll probably use both host hospitals, and maybe the good folks at MedStar could assist us in maybe kicking that off, or another hospital for that matter. We'll probably do both. Supply chain integrity assessment. We did a resource assessment about 2 years ago, but they've kind of further defined what this integrity assessment is. And what it looks like is really almost a consolidated list of suppliers and resources across the region, primarily the suppliers, who gets what from where, who gets stuff from Medline, who gets stuff from yada, yada, yada. And we want to try to get a broad stroke of that to see where we have opportunities there to either shore up that supply chain or at least have an understanding of where that stuff's coming from. So we'll do that hopefully in March. ChemPAC transportation exercise. So we'll follow up that February communications drill with at least a ChemPAC transportation exercise. So taking something from the ChemPAC host hospital, Anderson, or us here, and getting it to a location. That's what we'll be basically doing. So it'll be an abridged version of our ChemPAC exercise, and that is we're still targeting to try to get that done in April or March of next year, COVID pending. So if we can't do the full scale, we will definitely do the transportation exercise. And then we do this every year, 6 no notice EM resource drills just across the year. As long as we get them done before July, we're good. So any questions on items that are outlined in the work plan or things that we'll be doing across this year? Okay, take silence as concurrent, so we will move on. Oh, how'd that go up? Sorry. And
Phil,
pediatric surge annex. Thanks for all the feedback. Thanks for everyone who participated in the tabletop. We are putting in the final minor changes, and we will send that out to be reviewed and, for final review / vote. So we're going to take it from what we have and we'll do all that electronically or digitally like we've done in the past. We're probably going to do that one through Member Planet this time now that we have that capability. So please be on the lookout for that. We'll leave it open for, approximately 7 to 10 days so you can, have a final opportunity to take a look at it, and then we will submit it. We want to submit that. We have to submit that before 31 September or 30 September. So please be on the lookout for that, probably early next week, if not by the end of this week.
Phil, this is Eric.
Yes, sir.
I want to back you up one notch. I was a little slow on the trigger.
Sure.
The supply chain, of course, exercise intrigued me. Does anybody but me feel that that would be possibly beneficial in the midst of what we're dealing with as far as COVID and increased PPE and such? Would the supply chain integrity assessment be appropriate for things such as PPE?
Oh, no, yes, I would say yes.
Rick at Gateway. Yeah, I think it'd be a definite asset. It also, we could backfill and infill our MOUs too with some of those additional contacts.
Right. Hopefully, I agree with that, Rick. I'd love for us to learn from each other. Yeah, I'll be very upfront. You're in conversations that I've had with hospitals. Of course, we at our facility, because we are smaller, don't belong to a large healthcare organization. We possibly struggle more than anybody, and being quite honest, that has been a constant angst for me, continuing with our supply chain.
So let me see if I'm hearing that correctly. So you're asking to potentially just move that up instead of waiting till March.
Yeah, being very selfish. Yes, absolutely.
No, understandable. Any other thoughts from the folks? I hear Rick kind of concurring exactly. I don't want to talk for Rick, but it sounds like you concur with something like that. How about the folks out of Chester, Georgia, or Sue or Tina? What are your thoughts on doing something similar or trying to move it up in maybe October timeframe?
Sure, that's good to me.
Same here for Fayette.
Mm-hmm. And I'd like to include, and this was a wider net. I'll just put it like that, a wider net. We'd like to get the good folks at Abbott and MedStar, DUPA, all of, some of our EMS agencies, and a lot of you guys could probably, a lot of the resource hospitals could probably speak for them or get some of that information, because the way we were planning on doing it was to first conduct a survey, do a survey, have you sit with your supply chain folks, materials managers, and all that, and pool the data first, and then allow us to work together to comb through it, et cetera, as a group and outline it. So anything else did you want to add to that? Either I see Chuck was about to say something or Eric.
I was just going to point out that, yeah, we're still experiencing shortages because the hospitals have put caps, and we're all buying from the same people. And even though they have the supplies in stock, EMS is taking the hit because there's certain items we still cannot buy because the hospitals have put basically earnest money on it, and it's allocated for healthcare facilities, but then EMS can't get it when we need it.
Tracking, Chuck. Thank you.
I agree, Chuck. I mean, all of us have struggles that maybe not each of us understand from a different perspective. And that is why I would see great benefit in getting us all into the same room. And if we come away with one thing, it's a win as far as I'm concerned. And I mean, I know that I could learn a lot from my partners in our region.
And I'm wondering if we could and I'm thinking we could probably include some of our BJC, and we've got some good folks. I'm trying to think of some larger healthcare systems, OSF, We've got some contacts up there at their corporate side as well, because I'd like to try to get that perspective mixed in, with, our community perspective, our smaller hospitals. So, okay. Myself, Lee, and Scott will kind of chew this over and see if we can kind of try to target something for an October-ish timeframe. Because I agree with you guys. I think it's something that we need. Do I know what the full outcome is going to be once we sit around the table or on Teams meetings all together at the end? No, but I want to meet whatever that need is that the folks that are still struggling with, and walk away with something that can actually help in the situation. We've tossed it around here in the office, and I think there are some opportunities there, but collectively we got to come up with that plan. So, okay, Eric, thank you. Heard, understood, acknowledged. We will move forward with that. All right. And again, so please be on the lookout for the pediatric annex last look / vote. I'll skip over. I'll just say that if you weren't here for the last one, the pediatric tabletop exercise was a success. I think in talking with Lee, we've probably got doing the finishing touches on the AAR. Lee, how close are we with that? And because I haven't finally reviewed it, I know you were trying to finish up some stuff yesterday or day before yesterday.
I should have it done before I leave today. I'll send it over to you and have you, you'll have to wordsmith a few things. Let's face it, I have a public school education here, so my spelling's not so great.
You still spell better than I do. That's not a problem. The Maryland, DC public schools didn't do me any favors. So isn't that right, Greg? Where's Greg at? Because he's like my spell checker anytime I send a plan.
Sorry, I went to Catholic school. Those men taught us to spell right under corporal punishment.
There you go. Put those knuckles out here. Let's see. Okay. All right. So before we move over, I'm gonna open the floor up, because the next thing we're gonna move into is gonna be kind of a D4H demo, a training demo. So I'll before I set that up for Lee to kind of take over this portion, I'm going to ask any questions, concerns, things that you want to make, any announcements prior to this, because I don't want any of the folks that probably will never get into D4H. I want all my health department folks. I need all my hospital folks to be here. Love to have my EMS folks, because I know Chuck and probably John, they have accounts. I want you guys to be here, but there may be a few folks on that probably will never use it, and that's understandable. So I'm going to open the floor now before we kind of move over into this lane.
Phil, this is Tina Fayette.
Yes, ma'am.
Since I'd been gone for a while, was there an email that came out about the DH4 or D4H that I need to find now and go into a system to see what you're going to be educating everybody about?
More than likely, yes. Lee could probably answer that better than I can, but you probably do have an account, or you probably got an email that says, here, activate your account or sign in. And that link is probably dead, so he'll probably have to send you a new one. But you can watch. You can watch right now if you'd like. Lee, did you want to say something to Tina about that?
Give me 1 second, Tina, and I will send you the password reset link, which will get you into the system.
And for everybody who's going to join, you have to join it. You cannot use Internet Explorer. You'd have to use Chrome, Firefox, or Microsoft Edge. One of those three, or anything other than Internet Explorer, pretty much, because I think you get to it on Safari if you have a Mac or anything like that. So I did want to, before, again, I'll skip past a couple slides just really quickly for the upcoming events, and I will go back to that one slide and then we'll start over. But next Coalition Conference call is on the 7th, same time, same bat channel, same number, et cetera, et cetera. We're still in kind of a holding pattern on our decon training. We're going to get there. We're going to get it started back up, but we're still in the holding pattern. The IAEM hasn't been canceled. Well, it's been canceled face-to-face. However, They are doing virtuals. In our budget, I think I included enough money for 25 attendants for the region. So if you would like to attend the International Association of Emergency Managers virtually, please let me know. All you got to do is send me an email, and I'll send out another reminder about this. But just shoot me an email. Say, hey, yes, myself or Lee, yes, I want to attend. It's a great way to keep up some of your, I would say, continuing education in the emergency management realm. I'm not sure what the full lineup really looks like, but normally I would go to the Healthcare Caucus. That's where I met Andrew Friend while he was still over in Saudi Arabia. But I would continue. I would go to that every year, and that's been a very, very good caucus. It's grown over the last 4 years, and maybe they will have a breakout session for that. The National Healthcare Coalition Preparedness Conference has been canceled, and they do not have a virtual, as of yesterday, they did not have a virtual option like the IAEM does. So that one is nixed, it looks like. So this may be one of your only opportunities. And I don't know, Greg or Beth, if they've made any decision left, right, otherwise what they're gonna do with the summit this year. Have they started even talking about it at all, or they're just still primarily focused just on COVID and they'll figure it out later? Do you know?
Figure it out later.
Okay. So, but I wouldn't be
Hey.
surprised if it gets canceled like this one was, and maybe some virtual version of it.
This is Beth. I think I saw something where they're looking for a location, but the way things are kind of up in the air, I believe it when I see it. Second thing, real quick, we're doing some vaccination planning. So hospitals, start thinking about how you're going to do that. EMS too, of course. And third, the health departments have another call at 11 o'clock. So I will be dropping off. I'm guessing that most of them will also be dropping off. And I see in the chat that a few more health departments did join the call late. So they did not participate in it. So you might want to check that.
Thanks, Beth. Go ahead.
Phil, I will say while there's not been word on the next summit, I previous to COVID, they were looking at moving it back to the suburbs, just kind of as in the back of your head. Whether that occurs or not, I don't know, but just so you're aware.
Got it. Hey, Greg, and Beth, there was a question. I cannot remember which conference call or wherever I was listening to, but there was a question with regard, and it may have been on the Missouri side, I'm not sure, with regard to paramedics and them supporting vaccination clinics or the pods, and saying that there was an issue with pediatrics. Lee, were you in that conversation? I know John Perry was, but not able to provide pediatric vaccinations. I'm hoping it's a bad rumor, but I thought that there would not be an issue with regard to that if Chuck's folks were going to support a pod, whether it's closed pod or open pod, with giving vaccinations to children. Is there any truth to that?
I don't think it was a vaccination issue. I think that was regarding the swabs, the nasopharyngeal swabs. There was concern doing pediatric nasopharyngeal swabbing as opposed to the injection, because I believe that should basically be the same. It's just making sure you're using the correct dosing.
So actually the pediatric vaccination is an issue. It's being discussed in meetings. Something came out today, and I haven't had time to read about it yet, but there was a question about an age limit. More people than IDPH are weighing in on this. Pediatric Association has some issues with pediatric vaccinations, meaning the pediatricians feel
that younger children should be getting it in their offices and not in clinic settings. So there's going to be more to follow on that, but there is an issue, and it is being talked at the high levels between with the medical professionals about what the age limit, if there will be an age limit for paramedics. Also, dental folks are in this mix with, vaccinating, other pharmacists, those kinds of things. So it's not just the paramedics, but paramedics are in that questionable mix of whether there'll be an age limit or not.
I would say, and as far as I can tell, as the national scope of practice was adopted by Illinois with very few modifications, and there is no limit on age. So it would basically come down to IDPH saying yes or no. And if the American Academy of Pediatrics, since I am currently working on that vaccination stuff, I will make sure to follow up with the AAP to make sure evidence-based practice is written into our plans.
Thanks, Chuck, and thanks, Greg. So, okay, I wanted to get that out because I know I heard the conversation yesterday, and had me concerned. So had me just a little concerned. So, yes, work on vaccination planning. Be ready. So, all right. Any other announcements before we move over to D4H? All right. Well, if anyone has to drop off the call, thank you for joining. We're almost at an hour, and this won't take an hour. I don't think with Lee's going to take an hour. So I'm going to turn it over to Lee, and I believe he's going to have to request to share.
Yeah, I'm going to request control of it. I'm also going to show something else. This is actually coming from one of the coalitions in Texas regarding PPE. Let me see if I can get it pulled up here.
Yeah, you should have control now.
Yeah.
Or
you guys should be seeing a coronavirus disease update page. Can you see it?
It's there.
Okay.
Yep.
Yes.
So,
I see it.
yeah, if you go to this website, it's just CETRAC. This is the Southeast Texas Regional Advisory Council. They've got on their top of the bar there's a coronavirus disease update. If you click on read more, it'll take you to the page you're on right now. They've got a potential resources link that'll take you to an Excel sheet. These are companies that have reached out to them directly offering product and service. So if you're looking for masks or shields or anything, I mean, this may be an option to look at. They do keep this up to date. I actually got this from a buddy of mine who's in their coalition down in Houston. So just as an FYI, something to consider. The distributors are from all across the country, but if you do reach out and you find something that works, definitely let us know, because we'll put that into that whole supply chain, assessment. But I just wanted to throw that out there because, I know there was issues getting things, and if we can do it through non-standard means, it may be a better option. And we can send out the link if needed, but it's just setrac.org. All right. So moving over to the D4H system. So this is, when you first log in, this is what you're going to see. This is your main, dashboard, as it's called. Your dashboard may vary slightly as things get added. We start adding more modules, but the log. Yeah.
Haley, could you do me a quick favor? Could you like log out of yours and show them what that first screen looks like? You know what I mean? Because it'll.
Yeah.
You know what I mean?
So let me. Actually, so yeah, he is correct. When you first log in, it's going to take you to this. And then you guys will not see the COVID-19 because you've not been invited to that. That's what we're using in our hospital here. But the regional pandemic response, when you click on it, any channel you're invited to will be listed there. When you go into the regional, this is what you'll see. your log is just what it sounds like. It's basically your digital ICS 214 log form. And we'll show you where to update that. The map, why it's showing the Atlantic Ocean, I don't know, but this has got where you can zoom into, our region. We have a relatively current list of all of our various services and things in here. The hospitals, dialysis centers, the FQHCs, all of the information that we had available has been indexed on the map. So if you need to know where something's at in relation to maybe where you're thinking about putting an alternate care site or whatever, you can pull that up here. Back on the dashboard again, this will show the number of personnel who have been invited to this channel. So there's 64 folks that are actually invited or registered on this particular scenario, this scene, the regional pandemic response. Of that, there's 6 online right now. And we can click on personnel and it'll take you through and you'll see little green dots to show you who's currently online. You should see the next to the name and it'll show you what their role is. And so this is going to be your position as far as in the incident command or the hierarchy structure of the system. And we'll show you the way that breaks down here momentarily under roles. Resource requests. Previously, we've had you sending a 213RR to me, which meant I had to turn around and then retype everything into here. So we're going to use this system for what it was intended and have you just directly enter all of your resource requests into D4H. You can do it through a couple of different methods. You can either click on the link that's here above the 110 that shows that there's been 1 submitted, 1 in progress, and none completed. Down below, you'll see there's hospitals and health departments. As we have other entities, like if we got a request from EMS, EMS would show up. You'd see resource hospitals. You'd see whatever that category is that'll be categorized down below. And green means it's completed. So Michelle Milton had requested through the system. I entered it manually, but requested PPE. And that was in and it's been completed. So it shows as 1 completed. I have a demo that I'm going to show you in a moment that's listed as in progress. But to submit, you can either click that link at the top there where it says all HOPE requests, or over on the left-hand column, you can get to all of those individually just clicking on it. Either way, it takes you to the same place. So inside, if you're a hospital requesting supplies, you'll just double click on hospitals. If you're not a hospital, you'll choose the one that's appropriate for you. If you don't have something in this realm and needs to be, let Phil and I know and we can add it. But for the most part, these are the primary people who are going to be requesting resources from us. So in the hospital, I've got a demo PPE request. And when we double click to open that request, it has, you put in what it is you're asking for. So if you're asking for PPE, just put in it as a PPE request. The status, you're just going to leave it when you first open it. It'll say, request received, and you're just going to leave it in that status. The list, that's the category that you belong to. So as long as you clicked the correct category on that first page, you don't need to change this at all. Down below are the items that you're requesting. So you'll click the button that says add row. You'll put in whatever the quantity is. So if you're looking for 3 cases, then you'll go to the unit of measure and select 3 cases. The kind, if you're requesting PPE, you'll simply select PPE. If you're requesting supplies, let's say you're asking for, maybe it's start kits or, body bags or some other disposable supply, then you would select that and put the type, and I can't spell today. And then if there's something specific that you're asking for, you can put in, what it is that you want. Or if you're looking for, a specific add-on or something that needs to be with it to make it work. Those categories that you have, you've got PPE, you have supplies, which is the disposable items, the single-use items, the equipment. So your durable medical, so if you're requesting a ventilator or something to that effect, it's going to go into there. If you're requesting personnel assistance, you know, if we get to that point where we're having to beg for help with people, you can put in a personnel request. And then same thing if it's something that doesn't comply with any of this. Maybe you're asking for radio or you're asking for this, that, or the third. You could go to other and just make sure you notate in the description what it is you're after. As you go down, you'll get to the requested delivery and reporting location. As of right now, we do not have a way of really delivering. So that, at this point in time, unless it's something really big and we've made pre-arrangements to deliver it to you, it's always going to just be picked up from us. If, however, we've made arrangements on where it's going, this is where we want you to put in the address, and if there's something specific, just like when you're doing FedEx or UPS, tell the guy what door to go to, who to call when they get there, whatever. If you're putting in something and there's a suitable substitute, same thing as like what's on the 213 form. You can tell me, hey, well, we'd like this, but if we can't get that, we'll take whatever we can get. And that's what we're going to do. Because if we can't get exactly what you ask and there's nothing here, more than likely we're going to tell you unavailable. And that's where it's going to go. As you go down, you'll want to fill in who you are. You know, so what your agency or organization is, the message priority. If this is an urgent request, meaning you need it right now, not tomorrow, the day after, the day after that. Yeah, if you need it right away, if it's an urgent, then check urgent. If it's routine and you know you're just scheduling to pick it up on a normal pickup day, then just put routine. If it's a low priority and it's just kind of one of those, if you can get it or when we can get it, then just select low. Who you are and what your position is within your organization, as well as your valid contact number and email address. Special instructions, again, this is if there's some special instruction that we need to know. And then from there, when you go to the logistics staff assigned, you don't necessarily have to fill anything in, but if you know it's something that's going to come to, like, for example, me, you can put an @ symbol and type E. Sorry, say again?
I think you should.
I think someone's unmuted. But in here, you can choose the role who it's being assigned to. Like I said, you don't necessarily need to because automatically I'm going to see it when it pops in because I'm on this dashboard every day, all day. And then the rest of this will be filled out by us. If it's something we have to request or we have to order or whatever the case may be, we'll fill in the remainder of this because that's just for our tracking. If you do have something like maybe there have been a couple of instances where people have asked for something that they didn't know how to describe it. So I said, send me a picture. You can actually do that right here by going into the file upload, take your picture, or if you have a document that goes with whatever it is you're looking for, you can upload that and it'll attach it directly to the request. Same thing if you do a manual 213 RR, let's say, for example, you're a resource hospital. You're taking the requests that are coming from your ambulance services on whatever form you're using. You can actually upload that form here. I will say what we don't want is just independent EMS services creating their own resource requests because they need to go to their resource hospital first. And the resource hospital, if they can't supply it, then we'll escalate it to the RHCC and we go direct with the resource hospital, not the service. Because otherwise it becomes completely overwhelming. So that's the process for doing a resource request. Does that make sense? Does anyone have any questions about this specific module?
Hey, Lee, this is Phil. Can you just dip back when you go back out? I think you double clicked on this one, but show them, I believe in the top right, if they wanted to, yeah, if you go into hospitals and then the add, yeah.
So, and he brings a good point. When you click on the quick add, it will add these boxes here. You type in what your request is, or you can simply just double click that, and that's how you get to the full form. That quick add just gets the line created. We've asked them to change it so that it just by default goes to the form, but that hasn't happened yet. I also want to say, if you come across a bug in the system, something that just doesn't seem like it works correctly, please let us know. We have a very, very good working relationship with the manufacturer of this particular product. And they're very responsive when we go to them with an issue. We've actually suggested a lot of improvements to the system that have been rolled out across all of their client base and some things that they hadn't thought of. We're the first hospital to utilize this system for them.
And Lee, if you could show them how to print, email, and share like this type of form. So if they wanted to print it for their own, ICS requirements.
Okay, so I'm going to go back to my demo because it's got actual lines on it. Up here in the top, you have the little 3-dot, the hamburger. If you click on that, there will be a print to PDF option. You're not going to want to do the log because all that does is prints a copy of the audit log showing what changes were made. You won't need that. But like anyone who's picked up PPE from me, the form that you sign is basically this form. I just go to print to PDF and it pops it up just like so. And when you sign, you're just normally signing next to your name. Now, the forms we've used previously were slightly different because it was coming out of our hospital channel, not out of the region channel. The region channel is literally going out live today. So, but once you get into here, you would just print it using your normal print button. Now, if, like Phil said, if you wanted to share, you can actually share that via email. Or if you have in your hospital command center, you can create a public link to this. So when I click on create a public link, I copy that link. If I go to just a regular browser tab, I drop that link in and hit enter. Now it takes me to that form. So if you have like an internal website that you run for, or even it's a shared document that you run inside of your command center, you can drop that link in there and anyone can click on it to see it. Now they can't edit it outside of the system, but they can view it. And if you go in here and you add to that, we'll just throw a widget in, a widget, close enough. Once we've put that in there, now if I go back and I refresh my page, you'll see that it automatically adds it. So this adds in real time. As soon as they refresh it, they'll see whatever changes. And that happens across the system. So, and I'll show you more about what that means here in just a second. But so that's where this is at as far as the resource requests go. You'll see how the message that you see at the top, do you want to receive notifications? So I just got a notice. Someone had tagged me on something. If I turn that on, I'll actually get a little pop-up in the bottom of my, down in the bottom of my screen. They'll flash up and say that you've been tagged or something's been attached to you. It'll alert me because I keep this open all the time. That becomes useful if you're using this regularly. Again, you see it at the top. I've been mentioned. So when I click on it, it'll take me to where I was mentioned. I was mentioned in the log. And to mention, it's just like on, if you use any of the social media platforms, and start typing the name, and there they are.
And Lee, can you show them how that, where you see it in the log there, where it says demo PPE request, if you click on that.
Yep. So this is attached to that demo PPE request. So if you click on this, it'll take you right back to it. Now let's say that I've added, this is a new request and I want to notate that, or what I do when I actually fill your request, I click on this little message box up here in the top right, and it automatically attaches it to this particular request. And I can put in and at that point, it's now attached. You can go see that on the updates on the log. You'll see the demo PPE request is there. There's the memo saying, hey, I finished this. It's done. And if someone needs it, they can click on it and go to it and see it. Same thing, if I move it to complete, it'll change on the dashboard and it'll show that there's 2 complete instead of 1 in progress. I see there's a whole bunch of folks have put in stuff. And it looks like all in the hospital realm. So I have a whole bunch of new requests that don't have names. So when you create it, make sure you change that New Hope request to what you're requesting. That way I know and I can see just at a cursory look. It makes it faster when I'm going to fill these things.
And Lee, if you before you move off of that, can you go back to the demo PPE request? Because I went in there and uploaded a photo. If you want to scroll down, so I put those notes in there. In my notes that I had put into for Lee, I had said, hey, I made an adjustment to the form. So go ahead and click on your little notes, your chat function, whatever that thing's called. I'm sorry. So I put in there, I said, I made an adjustment to the form. Please take a look at the image I uploaded for the face shield. So I'm saying, like Lee's asking out, if you want to make something very specific, this is what you're looking for, that would help. And then everybody can see that. And then when he was talking about printing to that PDF and including that log, if you print that and include the log, it'll have basically that whole conversation at the bottom tagged to this one form. So keep going. So you get that picture of and now you have that whole conversation there too. In case somebody's like, well, I said, I thought I uploaded this on this day, you could have that information there too.
And we can tweak these forms very easily on the back end. And we can pretty much do that in real time. So if there's something that needs to be added or modified or anything like that, we can change it. So that is the resource request. Does anyone have any questions about the resource requests at this point? So what I'm going to do is I'm going to bounce back to the dashboard here just for a second. And if there was a request assigned to you, let's say, for example, I'll use Michelle because it was a great example. I've already done it. Michelle Milton's request that I submitted was the first one put in here as a live request. It shows that it's incomplete, but you'll notice instead of saying all hope, this is mine. This was actually tagged to me under that where we talked earlier down in that logistics staff assigned. Since I was tagged on it, if it was, well, I'll show you, if it was not in complete status, if it was in like request received and you tag me on the dashboard, it'll show that I have one pending that's assigned to me. If that makes any sense to anyone. If not, please let me know. But just in case anyone looks at their dashboard and goes, I don't understand why this says this is here. That's what it's for. If I close it out and I tag it back to you to let you know, then you'll know. When we look at the situation, so this is your ICS 201 or your HICS 201 form. This is basically just the gist, all your objectives, your situation summaries, just all of the normal stuff you would see in ICS. As you scroll down, you get into the high level of the actual ICS flow chart showing who's in what positions. And then down at the bottom, there's an option to put in images, pictures, or files or things. We used this for the pre-planning for like the Scott Air Force Base Air Show and had it completely built and pre-planned, ready to go, and had maps, had pictures, all of the things that the guys that were going out there would need to know. We've used this on the REMERT side. We've actually used this for a couple of just responses as a way to test. And we'll put pictures of, if it's a train wreck, for example, you could have pictures of the train wreck, both from news or whatever else. But again, those options are there. So that's where your location is specified. In this case, because it's just the whole region, we just had our office in there so that we could get weather data that pulls over. And I'll show you that here in a second. Under roles, these are all of the roles that are assigned out across the coalition. The things that are, you'll see how they're kind of organized by this. If it says HOPE, it means it's coalition position. So the REMERT team falls under coalition. Our Department of Defense partners, anyone who kind of just sort of falls into the ESF 8 realm or would be on that side. Our EMS coordinators in the resource hospitals, your local health departments for all of our counties, as well as our East Side Health District, and then the HPP coordinators. You will run into issue in one regard if you have two hats. So let's say that you're an EMS coordinator and you're also the HPP person. You can only be in one of those slots in the system. It really won't make a difference unless someone's trying to assign something to the slot you're not in. But as you go down, you got the regional coordinators, the St. Louis Medical Operations Center. If they're involved in an incident, if we have a large scale whatever, they may be in this channel with us and would be in that role so that you can directly message them. Our EMS services, and this is not a comprehensive list. This is just the services that I legitimately could, off the top of my head, start putting in. If EMS resource hospitals want to add their services to this, I can certainly do that. What I need are names, email addresses for who the point of contact is that would be getting the invitation, and what service they're with. Spelled correctly, because I will spell it wrong. Muscuda got jacked up 2 or 3 times before I got it right. Same thing with Millstock. But if you get it to me, I'll get them into the system and we'll get that set up. Our county emergency management agencies are also in here, since we do interact with them and they may need to log in and see what's going on. So if you see that there's someone missing, or if you have multiple people, like I know with Gateway, I've got both Rick and Danielle added because, depending on who's running the show that day, that's who's going to be listed under the HPP position that, is in the flow chart. We can have multiple people that you just put one in, whoever it is, that operational period that's filling that role. So that's the roles. And again, if the little dot next to the name is green, that means they're actually online. So there's a lot more green dots on them than there was earlier. That's a good thing. Again, over to the left, we have the forms. So right now, this just has some basic forms for the hospital incident command system, and they are just very basic forms. So your quick start, IAP. You can fill these out if you desire, and you can actually, like we talked about earlier, just print them to PDF. That way, if you want a paper copy to distribute out to your staff, or if you're keeping paper copies for your personal records, that information's there. There is an add button up here at the top. If you click the little add down arrow, this is a list of all the forms that are currently built into the system. We have both the hospital incident command system forms as well as the regular incident command forms, as well as a few other forms that we've developed specifically for like hospital decon for your responders. You're running an incident, you need to be tracking per the training that we've all received. You've got to track who's doing what, their blood pressure, pulse, and respirations, temperature, and all that on entry and exit. You can enter in all that information, for both entry and exit, as well as how long they're in their suit. This is something that kind of helps cover your backside in the event of any issues down the road. But there's a whole slew of forms. Feel free to play with the forms. If there's something, again, that you think needs to be changed, let us know. We miss things periodically because we stare at it so long our eyes cross. The map is, again, what we showed you earlier, just the map that shows all of the different key points that have been added. And if there's, again, other things that you'd like to see added, we can add those layers as well. Tasks. So the tasks, we have not built any tasks out really at this point. But let's say that we wanted to make a task for...
Hey, Lee. This Phil, sorry, hit cancel just right quick. You can pull up like the Kimpac one, like the if you go into the import, yeah. So yeah, that Kimpac respond, that's a regional one. Down.
I got it. Oh, that's earthquake. Same.
Yeah. Hit the Kimpac respond. It's for 3 down.
Yeah, I'm headed there. Okay, there we go.
Give it a second.
Yeah, it's pulling 189 lines.
So what this is going to basically do is, like you saw earlier with the HOPE request, you can see kind of those KIMPAC respond as kind of a list or a title for that. So if he double clicks on that, you'll see the entire response checklist that's in the KIMPAC plan. So if you wanted to take a look at that, or if we're running a regional incident, this is how we're going to run it. You know, we're going to make sure that those things are checked off. We still got a little bit of tweaking to do so we can make sure that all the assigned positions, now that we have all of those roles completed, we'll be filling that in. And then as those items are completed, so just check off some or put some in progressly. Those items, you could do it just from the main page.
But I'm sure, I just want to make sure they understand. If you open it up, there's actually ways you can put details, remarks, due dates. I see us using this in part of our day-to-day operations as we're working on some of those deliverables as a way to track the status of it.
Indeed, we use this in our hospital generally for some task force that I would say task force that we put together. But you know, when we were setting up the sample collection site that we had here, when we were doing different projects out, we had a fatality management task force that we were looking at. But as he goes, just go ahead and click and close and in progress a whole bunch of those really quickly. And as he does this, now you already know what it kind of looks like in the other version or the small version. But if you go back to the dashboard, you'll also now see, oh, you don't have it listed. There it is. There you go. All tasks. There you go. So if you can kind of see what he just did, that all tasks, when he went up there to the top right, that little cog, if you want to set your dashboard to show, you only want to see 2 things on your dashboard, you can select what things you want to see and click your My Tasks as well. So all of those will now show on the dashboard as when he logs in, he can see, okay, or I can see where we're at in the KIMPAC response. I can see where we're at and what we still have outstanding. And as you can see, you know, still 184 things not started. Again, key reminders for me and or your hospital to do things accordingly. We're going to tailor these again to make sure that we're targeting the right folks that need to do whatever task that is. So, but that's how we have the capability to bring in other tasks. So if we're going to have our burn surge annex, and we wanted to put in a checklist for that, we could do that. Evacuation, or regional evacuation annex, we would have a checklist that goes right along with that to keep everybody on track on the same sheet of music. So, sorry, Lee.
No, you're fine. So this, I realized as I was looking at this earlier, this particular form that we're going to look at, which is the region stat rep, this status board is not actually set correctly. And I'll explain why here in just a second, but it's the same as before. You'll click on quick add. It'll give you the line. You'll put in, you know, your organization, double click on the field, it'll open up. And in here, this is where you'll put your status report. So if you have any urgent needs, tell it yes. You notice the color automatically changed to red. That becomes important because it allows us to know, hey, that's critical. We need to deal with that right now. Date and time, your remarks, phone numbers. This is actually our hospital form. I don't know why it got tagged as region, but if you've got your primary, secondary phone, maybe a cell phone is your emergency phone, whatever. And then you can underneath of it indicate we use this again internally so that we can track injuries of whether it's minor, moderate, severe fatalities, volunteers, staff, patients, whatever the case may be. We can break it down and that'll affect how we react to things. We have a regional form built, but for some reason it did not get assigned in correctly. I didn't click something correct apparently. But we will have a form like this so that, let's say we have an earthquake, internet's still up, you can submit a stat rep. instead of having to call us and say, yeah, we're okay, you can just throw it in here. We'll all be able to see it. Everyone knows at that point that Sue's hospital is great because she's sending a positive stat rep. If Eric sends in one and then it's an urgent need, it'll show as red. And maybe it's something we can't immediately, because we're affected by the earthquake, we can't immediately respond to it. Sue, however, because she had a positive, would say, oh, you know what? Eric's red and he's close. I can help him. And that way it just kind of helps to let everyone see what's going on. It gives us that one big common operating picture. But again, I'll get the correct form tied over to this. So it's simple, just like any other form. Just click the box, fill it in. There will be areas with drop downs that'll be, choose a yes or a no. Or if it says add row, it's just a table that you're then filling in the blanks. If you need to delete one, there's a trash can to the right. It'll wipe it out. And again, there are no save buttons because it all saves in real time. You'll notice when I first loaded, for example, the ChemPack, this spins for a second. And the reason it's spinning for a second is because there's an awful lot of data being downloaded in the back. Once it's fully downloaded, that'll pop up instantly, basically because it's stored in your browser in the cache, so that even if you lose internet connectivity, you can still make these changes. And when your internet's restored, it'll sync to the cloud and we'll all see those updated changes. So again, under personnel, it shows you who's on by the green dot, what their role is. The weather option, for now anyway, the weather option that they utilize is from a company called Dark Sky. Dark Sky is going away, so they're actually moving to a different weather platform in the not too distant future. It'll be sometime early next year. But this just gives you an up-to-date forecast for the next however long you've got it. If you want to add on your log, if I wanted to actually, why did I not see my button? There's a button. Oh, duh, it's right there. I can go up here and click on it, that little weather icon on the top, hit send to log, and it'll actually drop the weather conditions as of 11/28 into the log. It's just another feature that's there. The notifications is something that we use within the office to be able to send out emergency notifications. It's not something that the regular hospitals would be using because it's through the Everbridge platform for us. In the library, you can add folders, you can upload files. I don't think we have, we have some stuff for the hospital itself that's already loaded in, but you can, again, if we needed to like the updated documents we got from IDPH on what the new policies are for the resurgence, we can add a folder, upload the file into that folder, and keep a running record of all that kind of documentation as we need it. Same thing, if you have something specific that you think needs to be stored, you can always drop it in here. There's no limit on space. Whatever we need to do, we can put it in here. The map annotations, to be very honest, it just shows you the list of what all the different points are that are in the system that go back to that map. It really isn't going to do you a whole lot of good. We won't really use that function, but it is there. So anybody have questions about anything that we've talked about? Anything Phil and I can try to answer for you?
And you'll notice just while you're sitting there, you'll notice I just put in like a high priority announcement where I threw it in the log where I said Region 4 mitigation measures updated effective 9/2/2020, and you'll see that banner up at the top. So if I put something in a log and I want to make it known to everybody that it's something that's important, or I can do that, and that's where you'll look to see those announcements.
And if you run into issues where you're not seeing things that are updating correctly, you can go over here to the green up-down arrow on the top, When you click on it, there'll be a resync local data, and that will tell the browser to go and pull fresh. It may take a little bit because it's got to download all that data again, but it'll get you so that if you lose that your Wi-Fi goes down or your internet goes down, you still have the ability to use the system until it comes back up, as long as you don't clear your browser cache. But I mean, that is in a nutshell right now D4H. If I forgot to mention this as well, the little 3 stripes at the top, if you click on that, that'll hide that left column. We did have some issues internally with staff that were like, well, where did that thing go? I can't find it. That's where it's at. If you close it, you can reopen it using the same button.
Hey, Lee, I have a question.
Go ahead.
I don't have the weather tab or the task tab on the dashboard.
Okay, so on the dashboard, you see a little, looks like a cog in the top right corner?
No.
You don't see a, okay.
Oh, yes, yep.
So if you click on that, that should show you all of the actual modules for what would be the right frame. But you're saying your left column does not have weather in it?
Right, it doesn't have weather or tasks. And
Okay.
and the settings, the configure dashboard option that you have pulled up right now, it doesn't give me an option for tasks or the weather.
Same here, Lee. This is John Nowak.
Yep.
Chuck
So-
Kelly, same.
Okay, so
Got it.
Phil-
We'll just look at the permissions. I'm looking at it now.
okay, yeah, I think we might have overlooked that one.
Hey, Lee, this is Kelly.
Go ahead, Kelly.
I don't have the weather one either.
Okay, yeah, I think it's going to be we'll have to make a global change. We'll fix it on our end. We just overlooked that apparently.
All right, thanks.
Okay, if y'all have questions, definitely let us know, and we'll send out. I did just a little Word document on how to do the resource requests. We'll send that out just so that you have, a refresher on how to go through this process, because I expect that this is going to be the biggest driver for us for the time being, and then just the regular updates. If there is something going on that you think everybody needs to know, this is the place to put it. Go to your updates, type in whatever the message is, and when you hit enter, it'll add it to that log, and anyone that logs in can see that. If you need to assign it again to someone specific, maybe you have a question that you think is something that everyone else is going to want to know the answer to, but you wanted to talk to Phil about it, you can, you hit it. Now it'll pop up on his screen. He'll have a ping to tell him that he got a message tasked to him, and he can figure out what the meal of the day is going to be, because it's getting on lunchtime.
Yep. And you guys should see, I went and changed the permission. So maybe if you just refresh your page, let's see if it pops up.
Mine, this is John. Mine did a resync, but it didn't add anything. The task or the weather.
You may have to log out and log back in.
Okay.
That's what I'm afraid of because of the permissions. And Tina, I do see your email pop up talking about the address. So the address for this, it's a good point. This one's a little bit more of a pain if you want to just memorize addresses. We'll send it out, but it's really just the d4h.live, and then it's /# memorial. I don't expect anyone else to remember that. So we'll send you a link that you can add to your browser. Or if you're in it now, just, add to favorites, because it'll be the same link every time, never changes.
Thank you, Lee.
Absolutely. And again, please, if you have resource requests, if you're adding actual resource requests, please do so. And what I'll do is all those blank ones went away. And so did the categories. Interesting.
They're here for me. They're all on mine.
Yeah.
Oh,
like,
you have my items highlighted. That's why. Top right. Right.
Okay.
Good time to show them. You can show them what that is. That filter.
Yeah. So the filtering options, you can tell it for just the things that pertain to you. And since only one thing had me tagged in it, that's why I only saw one. I didn't see that up there. But so what I'll do is any of these that are not real, that aren't going to be completed, I'll go through and delete them. I'll give you half an hour to add anything if you're wanting to make requests. Since we didn't talk about that earlier in the meeting, we still do have face shields. We still have some gowns as well as some coveralls. I was just reminded via email that we also have some lab coats, the disposable lab coats that the hospital, our materials management basically donated over. So we do have that as well. We have vinyl gloves. However, we are out of nitrils. No more nitrile gloves. N95s, we have some, not a huge selection, but we do have some 3M N95s. We have a slew of ear loop masks. So if you need ear loops, please let us know. Same thing with the Chinese KN95s. They're great as a isolation mask, but I would not try to rely on those in any way, shape, or form as an actual filtering face mask. But just put the requests in, and we'll be happy to help you to get that scheduled for pickup.
All right. Anybody have any other questions? We still have 22 minutes still here, and we're willing to hang out to test things out. If you got questions, we'll just hang here for a little bit. If not, thank you guys for joining today. Thanks, Lee, for walking us through that. Be on the lookout for a couple of links coming your way and a vote on that pediatric plan to go ahead and prove it. And I see somebody does have their hand raised. Oop. I can't tell who that is.
Hey, Phil, it's Sean.
Hey.
From BJC. How you doing?
All right, brother.
Hey, just wanted to get a status in reference to those exam gloves, Lee, when you said the nitriles. Is that been a issue for some time now for not only Region 4, but the state for the cash? Are you,
yeah,
we're seeing that on the Missouri side that we're running short on exam gloves.
Yeah, that's been an issue for us since the beginning of COVID, since shortly after the start. I get on almost every one of the resource requests that come in from anywhere, whether it's EMS, long-term care, the hospitals, anywhere. They're all asking for nitrile, and we just simply can't get them. I gave out the last case the couple of weeks ago. So yeah, we're struggling with it, especially the small sizes. That we had some mediums and larges for a while, but nothing now.
All right, thanks, Lee.
Any other parting shots, questions, concerns, anything about D4H or otherwise? All right. Well, we will close it out here. Thanks for joining. This will be uploaded this afternoon. Thank you. Have a good day.